Happy Tuesday, and welcome back to another episode of MSLead Chronicles, where leaders learn from leaders. I'm Mary Morton, and along with my buddy Chad Fellers, we have casual talk about the challenges and successes in medical affairs with the most exciting and impactful professionals in pharma. As always, we have another great one for you today, so stick around.
Oh, hello and welcome back to another casual conversation on MSLead Chronicles, where leaders learn from leaders. I'm your host, Chad Fellers, along with my nifty sidekick, Mary C. Morton. I'm not going to say what the C stands for, but C. What would you say that you would want it to be if it weren't what it is right now? Can you tell me a name?
Well, I like Catherine. That's my real middle name. But in honor of Jerry Garcia, this is what is known by dead fans as the days between. It's days between his birth, the day he was born and the day he died. And my daughter is named after a Grateful Dead song, and her name's Cassidy Page. So I'd go with Cassidy.
Okay, not Catalina.
Is that what you're expecting me to say? Surely
I thought so. After all the years that we've been together, after all that we've been through, Mary. So
I'm sorry.
I'm
sorry. You're right. Next time, ask me that next time, and I'll say that.
Fair enough. Yeah. Fair enough. Well, let's get into the conversation today. I know that this was something that we were sparked by a post on LinkedIn that gained a lot of traction. And so with that's my tease for it. That's all I've got. So Mary, you're the one that really drives these intros. Would love for you to introduce our favorite guests for us today.
Yes. So joining us again is Mitch D'Rozario, PhD trained neurogeneticist, MSL, and unless anything has changed since his last visit, still has his master's in progress for his MPH. Mitch has applied his scientific and analytic expertise in both ophthalmology and oncology throughout his career. He has a particular talent for finding the signal in complex data and turning it into a story that people can actually understand and apply and use. He's a scientist. He's a data strategist, still a dad from Bloomington, Illinois, and still apparently somebody that you want on your trivia team. Is that still correct?
Mostly, and done with my MPH as of the summer. So, yes.
Congratulations.
Congratulations. Yay. Look, I have like a little bell here. This is Nicole's bell.
Oh.
All right. So I keep Nicole's bell on my desk.
Forever learner. He's a forever learner. What's going to be your next?
Taking a pause. Taking a pause, right. and then reframing.
Don't blame you. Well, congratulations on that. That's a lot of work, especially. Listen, after going to pharmacy school, that's why I keep my license up to date, because I'm scared to death that I would have to take the NAPLEX again if for some reason, from 26 years ago when I took it. I didn't think I'd pass it then, and I certainly wouldn't pass it now. I can guarantee you that, right? So, so for you to be able to do this at your season of life, kids and things, congratulations. That's fantastic, Mitch.
And actually tease up a couple of my hot seat questions.
All right, good.
Okay, so as we talked about, Mitch is a dad. So kids these days are teaching us all kinds of words. Like I thought keeping it crunky was still in favor, but it's not keeping it crunky. So what is some of the vernacular that you have learned from your kids?
My kids are young, so they're not exposed to some of the vernacular, but we did go through the 6-7 household for a long time. Yes. We have a 6-7 magnet in the house. We have a 6-7, like a figurine that one of my friends made for us, like a 3D printed. My kids were 6-7 last year, so it was a very important milestone for us.
Wow. Yeah. Well, we still do that one around the house, but I think we started it because we thought if we just embrace it, they'll stop saying it. But It hasn't happened.
No.
Okay.
My kids are at that age where they're embarrassed of their dad doing things like 6, 7. So yeah, I'm grateful for that.
Mine aren't. They're 25 and 19, and so they aren't. They just let me embarrass myself. Okay, so next question. What is the trivia gap on your current trivia team?
Ooh, none. We're actually doing really well this year. Yeah, so we have at the end of the year, we have a Super Bowl, a trivia bowl. So we're placed really well at this point. I don't add any value except for whenever there are science questions, which are very few in Central Illinois.
Okay, all right. And then
what's your team name? What's your team? Do you have a team name?
That's a great one.
Spirited Bunch, because they started at a bar named Spirited Republic, and so yeah, we're called the Spirited Bunch.
Okay.
How long have you been together?
Say again?
How long have you been together? Been doing this?
I've been with them for about 2.5 years. They've been with this team. They've had this team for about 7 years. They've been a champion once. I've never been a champion with them, but yeah.
Okay. Wow.
What do you get? What do you win?
Name on the what
plaque?
Is it called? The club on the plaque. Yeah. You get a name on the plaque, and bragging rights.
That's really all you need, right?
Yeah.
So I'm going to ask you an oldie but a goodie, which you've already answered for us once, but I want to hear it again. Do you have a new walk-up song? It's summertime. Anything new that you feel like that inspired you to walk into a room and own it?
I mean, the summer song I think of is the Childish Gambino summer song. I forget what the title was, but that's one. I had prepared for a different one for you guys today because I knew this question was coming.
Okay.
It was going to be Down with the Sickness by Disturbed.
So why Down with the Sickness? Oh, okay.
It's a good song.
Well, I have to show you. I open up my Sonos and there he is. Childish Gambino.
Oh, yep.
It's like, I doubt World Star is the one you were talking about though, right?
He's so talented.
Oh, yeah, man. I love him. And he's brilliant. He's a genius.
Yep.
Donald Glover?
Yep. Fantastic.
We'll talk about it later, Chad. Okay. So Mitch recently posted something on LinkedIn, and I immediately contacted him to tell him he had to come back, and we were going to dig into this. So Mitch argues that the real value of medical affairs isn't collecting every single observation that you make in the field. It's having the judgment to be able to distinguish between what is a noise and what is a meaningful signal, and figuring out how to make that influence strategy, or if it should. So no further ado, turn it over to Chad to force you to introduce your takeaway for today.
Enough said. Yeah, it was a great post. I love the back and forth and some of the things we talked about. So we get to really hash it out a little bit more, dig into it a little bit more today. But with that, so the topic is insights. In essence, our favorite conversation. I think you're gonna, based on that post and some of the things we've talked about, you've got a different angle that you want to talk about today, specific to insights. So with that, do you have any key takeaways for our listeners today?
One is, for me, is seasonality. Insights change, but sometimes they come back again in a different flavor. So how do you notice that within a team is important. And then the second one I think important is feedback loop. How do you create a feedback loop so that the insights that come in actually change strategy, or they confirm the strategy that you're on?
Yeah. Music to my ears. Music to my ears.
What are your thoughts about this, Chad?
Hey, don't you MSL me. This is MSLead Chronicles, but you don't have to MSL me just yet. Yeah, we'll get into it, though. That'll be good.
I'm probably going to interrogate the both of you at a couple of points.
Probably so.
since this is you guys are both the the co-kings of insight.
Co-kings.
Yes. So, not everybody that listens to or watches our podcast are 100% insight fluent. So, from your perspective, and weigh in, Chad, as well if you'd like, what do you think actually makes something an insight? Because everybody thinks they're collecting insights, but what really separates like an observation from an HCP complaining about something, or some learning that it's a trend, or can you go into that a little?
Sure. I think defining what an insight is really important, right? So an insight is something that changes a decision or confirms that the decision we are on is the right one. If it doesn't do either one of them, I wouldn't think that it's an insight. And so you might say, Mitch, like not every insight needs to change a decision. That's right. But the insight kind of builds on the conviction as a company that you have. And that is kind of where I think the secret sauce of insights are. I'll pause there.
Yeah, I would agree. I would agree with that, Mitch. I think it influences decisions one way or another, that we're on the right track, that we need to adjust course, what's going well, what's not, what are the things to watch out for, what are we hearing that could be the trajectory of the company 6 months down the road based on what we've learned. They have an opportunity really to inform and impact business. Requires a lot of different things to go along with that, certainly, to make that happen, but 100% align with you on that. I even look at them as, well, let's just look, before I do that, if you could define an insight in one sentence, what would it be? If you
in
had to
one
identify
sentence?
it. Yes.
An insight is the currency of an MSL team that brings value to the company by providing real-time knowledge of what's happening in the field. Again, I used value, not volume, because that's another discussion to have, right? Is we spend a lot of time talking about volume, but this is more of the value to the strategy. And then again, as going back to what I just said, does it build on the conviction, or does it allow us to change and pivot?
Yeah. So in your years of doing this, where is the mistake usually made, right? What gets mislabeled as an insight most often that you've seen?
I'll be very honest and transparent. I'll share my example. So starting off the first year that I was in MSL, you're eager, you're hungry, you want to prove yourself, right? You've been given this opportunity to be in MSL, and it's a fantastic opportunity, and you go in and you want to give your best. So how do I give my best as a new MSL? Well, I go to a conference and I take every picture that is being presented on the slide. I go to every poster, take picture of all of them. And then I have these long write-ups to prove that I was there and that I took notes, valuable notes that I'm bringing back to the company. What I quickly learned was that I was losing credibility because I was bringing up too much volume of information. None of it was fitting into a strategy. So it required me to have a senior MSL kind of say, Mitch, like, why are you putting all of this information? Have you looked at what's on strategy for us? Have you looked at what's on our pipeline right now? And does this fit these insights that you're bringing in? Do they fit where our pipeline and our product and our strategy is? That was a huge unlock for me, where now anytime I go to a conference, I'm listening for things that either match or differ from what our existing strategy is.
So I think that's absolutely agree with you as far as when it comes to understanding what strategy is. I think one of the things, if I reflect back just even through my journey, I'm not so sure I always knew what the strategy was, right? Or even if that was communicated to us, hey, these are the things that we're prioritizing as a company. It was more of, hey, insights are really what we need from you. Go and get them. Now here may be some themes, or buckets to put things in, but there really wasn't much direction as well too. And so I think sometimes there's an attempt to try to prove yourself, like you just discussed, and prove your worth. But that's done at the hand because there's not an understanding of what is actually expected of it at the very beginning. So I think as leaders, it's really important for us to really set the stage about what is important, what is not important. Of course, there might be organic things that come up. When I go back to thinking about insights, I don't think I really communicated this well just a second ago. I think it is being able to understand what's driving the behavior or the response that's given, right? So, and in establishing establishing credibility, leveraging your scientific credibility to influence utilizing the data based on the response that's given there too, right? So if we don't know what's driving the behavior, I think if you understand what's driving the behavior, rather, that really is the currency and can really inform the business on why they need to do something as well too. So, just want to add that. What are your thoughts on that component of insights?
I think the question to ask is so what, right? So I heard this, this was said by this person, and so what, right?
Yeah.
And then the so what, I think there's a couple of things that are important here. The so what is, what does it mean for the company, right? What does it mean for the teams, the medical teams? But then sometimes so what could also mean, what does it mean for the commercial teams? What does it mean for marketing teams, right? Is there a knowledge gap that I've identified? And that is maybe that is important, that maybe this is something that medical can play in. It's something that we need to pass the ball to a different team altogether. That's where I think understanding what's on strategy for medical, but then also understanding what is on strategy for your commercial colleagues, for your marketing colleagues, for access solution colleagues is really important, at least having a broad overview. And the longer you stay in this role, the more you build these connections and you go out of your way and you meet other people within the company. You're not just staying in medical. And as you understand what their priorities are, you can then flex as needed, right? Because I don't think medical is going to solve all of the problems, right? It's a team sport. That is very important. But then the other things, Chad, I wanted to kind of get your thoughts on this as well. Is how do you ensure that the listening priorities that you have is not a self-fulfilling prophecy? And so here's the thing, right? So you might have a strategy that you've put in on a year and you want to ask about something, but you already know the answer, maybe, right?
Yeah.
And you're then asking, the tactical would be that the MSLs are sent out to the field and they're asking those questions, specifically what you've framed them as, but it doesn't allow openness for you to get additional feedback, right? So then you bring it back to the team and they're like, Mitch, I already knew this. And that's where the challenge is sometimes.
So, yeah, I think one of the things that has been really important to me over the years, especially it was probably 3 or 4 years ago, Mitch, the reality hit me. We were going through year-end reviews, right? So we were looking at as a medical affairs leadership team. So here were the goals of medical directors. Here's the goal of the field. Everyone had different responsibilities. But it was interesting at the time because the field, one of the goals they were trying, or leadership was trying to put in place, other leaders were, how much did the MSLs move someone across the scientific journey? That was like one of the goals. And so I looked at that, and then I also looked at the medical director's goals, and it was to have 2 publications for the year. Right. So one of them is objective. One of them is subjective. But then why are you putting all the pressure on the field to move someone across the scientific journey? Shouldn't it be that that the field is a conduit for, like why are the medical directors not being held to a standard that not just having 2 publications, but how does this data move someone across a scientific journey, right? So my answer to your question is we need to think about this as we're just a different extensions of one group of medical affairs as a whole, and not bucket it out as individual ones. There have been times that, yes, as a leader, I've been asked to develop questions, but doing it in isolation, it leads to things like you just discussed, right? So it's mission critical to have these conversations and align with your medical affairs directors, even your cross-functional colleagues, understanding, hey, this is how all this rolls up into the overarching business strategy. That's why you have those layers, if you will. If you're doing it on your own, it's going to lead to some of those things where it becomes, well, look how many insights that we have. Well, that doesn't mean anything. It's more of like, what if you had this as we'll talk about this more, Mitch. I think I even said that in the response. I think key insight questions are the way to go. I really do. And it can be one for each one. And yes, I think you can quantify those if you can leverage different resources and you understand what's driving the response that's given as well too. If you can say, hey, we asked this question, or based off the data we presented today, how's it going to impact? This will impact my clinical decision making. Yes or no? Okay, why is that? And if you can come back and say, hey, we asked the HCP, we asked the nurse practitioners in the West, 50 of these, they said, 80% of the time they said, yes, they will impact their decision making, and here are the drivers of the reason for that, or vice versa. They're undecided, and what's driving that? It's because of this. And 50% of the time, this is the reason why they're hesitant on this. That is the gold, I think, that you can really bring back, and people quit asking about how many people you engage, et cetera. But I still think you can quantify it that way, right? So I think that was a long-winded response, which I'm known to do, but I get on this and I get passionate about this. Mary, be quiet or hide your face when you said it about being long-winded. I think you have to have alignment. You have to have alignment across medical affairs leadership, and they have to have alignment to the business. And that's how I think you overcome that. What are your thoughts, Mitch?
I agree. I think that's one key point of overcoming. The other thing also I was kind of thinking about was confirmation bias as well, right? So when you have the key insight questions that you're putting in, are you keeping it close-ended in this case, right? You were talking about yes or no. But if you're going to keep it open-ended, maybe kind of guide the team before they go in asking the questions, what you already know, right? Because then you might actually get, in addition to confirming what you already know, maybe it might uncover things that you weren't aware of, right? So the kind of the known unknowns and the unknown unknowns, right? Those are kind of where I kind of think of it as kind of a strategy game, right? Where, here are the questions and what are the outcomes we might have, and then are we getting something different or similar?
So talk about that a little bit more, if you don't mind. Can you give an example, just a generic example of how that's shifted based on that to ensure that confirmation bias didn't exist in that scenario, that you're not asking something? Tell the listeners where you've seen that at play, or how you've and what you've done to take action to make sure that it was not just confirmation bias.
I think one of the things we can do is use AI in this case, and we'll talk about AI as well. I think there are benefits, and I'll talk about some of the challenges that I've faced with AI as well. The way that I would kind of think of it is, let's say you have a strategy that is looking at a medical care gap, right? Or a care gap that you've identified within. You already know what you can look into PubMed and you can find different publications that are talking about that care gap. What I would do is slightly different, where you have the questions that is being asked by the field. You collate that in your CRM, and then you can tease apart, based on what you know, you can tease apart the ones that are already published in PubMed. And that allows you to kind of, by subtraction, find things that are unique and new. And then, Chad, you can ask question, is this a regional thing? Is this a national thing? Am I hearing this only in the South, or am I also hearing it in the West? Because then it kind of takes away the, Mitch, we already knew this. Yes, we already knew this. Hence, we've taken it out. And then here's new things that we're picking up.
That's good.
That's one. The other example I think of is, having these regular insight presentations. A lot of teams do this. Oftentimes I've seen people either sending 80 slide PowerPoints to everyone that just sits in your mailbox, right?
Yeah.
Or you have these 2-hour long presentations about what the insights were, and you're basically reading from a slide. Now, how can you make it more dynamic is the question. Can you leverage AI where you can make it dynamic, where it's not a push, but it's a pull of data, where people can go in self-directed and pull whatever insights, whatever questions they have, they can pull insights from the field directly. I think that would be a game changer.
Yeah.
Or being able to have a discussion where Chad, let's say Chad, you, Mary, and I are on a team. We bring in insights, we're presenting it to a team, and we can say, based on these, here, can we align on these 3 different topics? And so based on these 3 different topics, who's going to take the responsibility? Which part of the company is going to take the responsibility of answering this, and what time?
Yep.
Right? It's time limited, responsibility driven. And then what it allows us to do is then cross it out and say, all right, out of the 3, we've crossed one of them out. That allows us to bring the 4th one out that we didn't present.
That's good.
So you talk about confirmation bias, but what if we have 3 things that we're looking for, and then the 4th one comes up and we weren't looking for that. I mean, do you see those things getting ignored? That's not in our strategy. How do we overcome that?
Oftentimes we don't have a good system of logging all of the priorities that we didn't decide to go to, because things are seasonal, right? Maybe this year where we are, this is not something we're going to go into, or maybe it's something that's not compliant for medical to go into, right? And so documenting those is important. But then the challenge is that everyone has dashboard fatigue. Everyone has spreadsheet fatigue as well, right? Are you going to create another spreadsheet? That is always a challenge, to kind of keep that institutional knowledge intact, but then also make sure that you're not reinventing the wheel.
One of the things I was thinking about. One of the things I was thinking about when you were talking about, we get dashboard fatigue or CRM fatigue or whatever, but I wonder if everybody's documenting everything, and then you start doing the sifting of what's different than what we've been hearing, and you've got a sieve full of all these same things that we weren't even expecting to find. And what do you do with that?
I actually used my MPH for this. Can I share that story?
Yes.
Absolutely.
Right. Yeah. So you know how we are having this whole this outbreak right now for cyclospora in it's in they think that it's in your lettuce, and it's causing people discomfort and whatnot, right? So how does a public health official deal with this, right? In public health, what they do is they do unstructured interviews. So let's say someone gets sick, someone from a public health official reaches out to them and does an interview with them. They might have some structured questions. Most of it is unstructured. And what they do is then they look for keywords, key themes, build a taxonomy, and then they're trying to map where this outbreak is. That's the same problem we have in field medical, right? We have these unstructured interviews, which is mostly qualitative, right? And what we're doing right now, Chad, oftentimes we're doing summaries, right? So we're using AI to summarize what we're seeing. Now, what AI does a really good job is that it does really good summaries, but it also smoothens the noise, right? So now it's very compressed and you can't pick the signal out of the noise. What we can learn from public health is something called mixed methods. And mixed methods is basically what you take qualitative data, you build a taxonomy, take the qualitative data, build a taxonomy around it, and then you can turn the qualitative data into quantitative. So paragraphs upon paragraphs of insights, because right now MSLs are asked to put insights into their CRM. That's what we're looked at, right? We looked at the number of insights maybe that are being put in from number of interactions. But we don't have the engine to harness that information, that input, and put it into a useful output. In public health, they use something called mixed methods, where they will take all of these unstructured interviews, build a taxonomy, and then not just keywords, but themes, build a taxonomy, and then you can show year over year, quarter over quarter, what is the trend like? Are there certain topics that are coming up more frequently than others? And that's kind of where I feel field medical would really excel at, because that's where we show the value.
So have you tested this, or is it more theoretical?
Do you know who
for
you're
you right
talking
now?
to? You know he's probably back there designing something like this right now.
I may or may not have.
You can't
he's
tell.
10 steps ahead of everybody, I think.
Yeah, he is.
But so I'll give you an example where I did implement this. So if you follow me on LinkedIn, I work with an organization named Smile Bangladesh, where they take surgeons from the US to Bangladesh to perform cleft lip surgery on patients, children, and maybe adults as well. What I realized when I went with them was that we don't have any patient-facing survey that has been done so far. So I basically built a survey, had someone translate it to Bengali, which is the language that they speak, and then have a community health worker do the survey. And so these were, semi-structured information that we brought it back, and then I was able to analyze it and find trends within them. So these are things that are feasible. And I think you can use AI for this as well. But I think what's really important here, Chad, is building the taxonomy, building the words or building the structure, teaching the AI what the structure should be, and then analyzing it.
Do you think it's already there? Have you played around like with Copilot, think like and then ask it to build it that way? Is that something as simple to do it with that? Or again, do you have to have a firm understanding of, I think I'm probably answering my own question, right? Because AI is going to provide you a response one way or another. The question is it really legit or not? But I'm just curious. I mean, is that something, the way that you put in a prompt, is that something that could help with this, or is it truly going to require even more rigor, if you will, to make this really become a reality, Mitch?
It would need a rigorous prompt, and it would be recursive, where you build the first tool and then you fix it, find flaws, fix it. And I think that's where the secret sauce would be, right? So it would be something that you would build in your prompt, extensive prompt, examples that are in the prompt, and then it would be recursive, where the tool would be able to identify flaws in its judgment. What AI is not going to replace is judgment, right? And I think that's where this human in the loop is going to be really important.
So where do you think that inexperienced or new MSLs tend to struggle the most? I mean, one of the things I think Chad maybe said a little while ago was, the leadership needs to make sure that the team that's going out there and bringing all this stuff back really has a firm understanding of what the strategy is. But once they have that, what do you think that maybe they do struggle with? Like you said, you've been there before yourself. You were brand new MSL once. So besides just like going for volume over value, as you said, what do you think they're missing that they could stand to learn?
I think one of the mistakes that I've learned is not to treat an interaction with an HCP as an interrogation. So giving yourself enough space to not just go in with all of these set questions that you're going to go through and mark them as completed. Because when you do that, it feels structured, it feels restrictive. So having enough space where you are looking for insights that maybe are hidden, right? Or needs to be teased apart. Hopefully that answers your question. So I think one of the mistakes, obviously two things that I feel if I wish I knew before becoming an MSL was not confusing volume with value. And then the other one would be not treating it like an interrogation.
Yeah, I hope that a lot of the aspiring MSLs that we talk to, and 1 year, 2 year, even MSLs, all of them, understand that there's an art, and like any art, like any talent that you have, if it's dance, singing, or MSLing, that you have to continue to work to develop it. You don't start day one as the highest EQ MSL on the planet. There's always room to grow and be better at discerning different things. And so don't put too much pressure on yourself because you're always learning.
Discern is such a fantastic word to use here. Yes, I agree. Discern, restraint, and brevity.
Mitch, you mentioned something, and that's why I go back to. I tried this with one of my previous teams when I was so adamant about leveraging key insight questions. I think it's keeping it simple, and I'll never forget when I first did this. The expectation was to integrate one in a conversation, right? So there were 5 or 6 questions, different areas. That way it gives you a ton of different directions to go. But we should say each engagement should have some type of strategic objective, right? You should have a reason for doing that aligns to business strategy. Our first insight review call, one of the MSLs was so excited because they asked every single question right in the midst of this, and you're right. There are consequences for that as well too. I mean, how many times do we struggle enough with when you think about some of these organizations that have 5 or 6 different teams now that call on these providers, right? So for one rare disease that may see 2% of their patient population have it, but yet there's 6 people calling on them. Their time is money. And all of a sudden they start saying, well, hey, if you're going to ask me these questions, why don't you pay me for it? Right. Or I need to be a part of advisory board or this, that, and the other. So you have to be very strategic about it. And I would rather one question be asked and they go deep on that conversation, understanding why someone responded the way that they did, et cetera, versus them asking multiple questions, 5, 6, or whatever. And because it becomes an interrogation, and then it becomes, wait a minute, this was about what you can provide me, not what I can provide you, which is ultimately the responsibility, right? It's a two-way street, and we don't want to lose sight of the KOLs always first, and their needs are always first. So I'm 100% alignment with you regarding the whole interrogation component. So yeah, we actually did it where 70% of the interactions had to have at least one insight question asked. Giving room for conferences or group discussions or things, you're not always going to have time to ask questions, but we wanted to make sure that if it really does matter to the company, these things, that we prioritize that, just to ask one. So anyway, get your thoughts on that.
Yes, Anne, on this as well. I think I heard this publicly on a podcast where a hematologist was talking about how he interacts with MSLs and medical affairs. And he said that we have to act like we're scouts, like a baseball scout, and we look for, who is the best of the best. So I think even because of the number of interactions that they have with all of these different pharmaceutical companies, they have kind of a running list of people that they want to work with and don't want to work with. So if you come off as an MSL that is just selfishly just asking questions and not engaging in a discussion, that is going to be difficult for you. Chad, the other thing also is, I think the other friction that we have internally is from a leader is how do you maintain the quality of the insights that are coming in, right? It's not just about the analyzing part. We talked about that. I think that's a big challenge. But how do you keep the insights that are coming in, the quality consistent? And I think the struggle sometimes is that the way that our structures are made, if I had a 15-minute discussion with a physician, it's going to take me 15 minutes or more to document it.
Yep.
Because of all the drop-down menus and all whatnot, right? I would then have to remember if I'm using the same structure that has been shared or I was trained on. And I think that where you can remove that workflow friction for the MSL would really help you unlock better insights. Where I see a lot of challenges is that what ends up happening is that people are just putting in observations, right? And HCP has moved institutions, and HCP did a panel presentation, and that is just an observation, right?
Yep.
And there's two reasons why maybe they're not going into it. One is of the administrative burden of having to put that insight in, or second, they're concerned or they don't know what the right way to put it in is.
Yeah.
So how do you manage administrative burden?
Make it easier for them. I have a solution for that as well, but I can't talk about that.
He's full of top secret stuff over there. But I mean, I would say that that's, from my side of the world, we have the same thing. I know I've said this a bazillion times, but we have a CRM that we track our conversations in, and where we're keeping track of, if Mitch were looking for a job, he's not. But what he would be most excited to hear about, just like you would do with your HCPs on the things they want to have conversations about. And it is burdensome. It would be, so maybe when you're able to, you need to tell me how I can make it less burdensome on my end.
I would probably look at how would you have a system, because everyone has, Mary, you within your team, people write things down differently, right? Some people maybe and what I mean by that is some people might actually prefer typing than handwritten notes. Some people might want to speak into it, right? So I think you need to have a system that is multimodal, and it allows you to take your shorthand and convert it into the structure that you want.
Yes, we do that, and we have a combination of free text and drop downs. For the same reason you guys do, if you just want to search for one particular thing or another. But again, another episode sponsored by Whisperflow. So I'd like to talk a little bit about the role of the relationships that MSLs have with HCPs. Because as I hear from you guys, sometimes the best insights are not what you were trying to gather. They're things that sort of just come up organically. I mean, do you think do you think more of the insights are coming from the strength of your relationship or from these insight gathering questions?
I think it's a mix of both. Both are important because when you have long-standing relationships in your territory, people feel comfortable sharing their opinion, knowing that sharing it with you is going to maybe change strategy for your company. So there's an intent behind sharing something like this, right? They want your company to benefit more patients, right? And the opposite, also, you want to hear from them how they're treating their patients, so that you are, so that they have the right treatment for the right patient. That is important. What is also important is for home office and leadership to build certain questions that keep your discussions focused and to demonstrate value.
Okay.
And I think that those two things go hand in hand there.
I was thinking about t-shirts I think that you should have made. And one is like value and then the greater than sign, volume. And then the other thing you said, interaction greater than interrogation. And so that one right there, I think is like the less you interrogate a KOL to try to get all of your insight questions answered in one visit, I think probably more likely they are to want to give more than you're asked.
I agree. I think I value my HCP interactions because they're sharing their candor to share meaningful insights and it's our responsibility to take those insights and either build onto our conviction or change and pivot. And I think we do it a disservice when we don't do it properly.
See, so one of your other points, golly, I can't believe the time is already flying by. I want to make sure we get to is around the idea of feedback loop, right? You mentioned that as one of your takeaways. Talk a little more about that. How have you seen that really show up, and what has been the result of doing it that way? Can you share any of your learnings?
I think we think that judgment is sometimes, we might argue that judgment may be innate, right? Some people are born with better judgment or not. I think it's also something that's a muscle that you exercise, right? So the better decision making and better judgment comes from evaluating how the outcomes were based on what you tried to do. The shorter the feedback loop, the better, because that allows you to course correct versus, something that has happened many months ago and then you're trying to evaluate if it was functional or not, I think is not as beneficial. The other thing also really important is to have that institutional knowledge that maybe something that you're hearing right now is seasonal and it comes, as I mentioned, maybe every quarter, or maybe it doesn't happen every quarter, but happens over years or multiple years. Being able to measure that is really important and critical, because what you don't want to do is end up just on a um, short term remembrance that you can only remember certain things for a short period of time, and then you forget, and then you're reevaluating the same thing again.
Yep. Well, and one of the things that we haven't really even talked about is we're just looking at specifically for field medical. Like, and this is multi-channel. We need to be thinking about this from a corporate level. When you think about it from, what is med info? What's the frequency? What questions are being asked? How is that shaped over time? The different outlets of communication beyond just the objectives for the field team. We should really be looking at this in totality, right? And now we have capabilities that allow us to do it, right? So that's one of the things, Mitch. I've been so passionate about over the years is how to help equip people to be able to position medical affairs as a strategic pillar. But how do you do that? Well, there's no excuse now, right? You used to be able to say, well, it's not tied to sales. You can't really measure activity, this, that, and the other. With technology now, we can be able to tell the story. The problem is we were having to do it manually so much. And just your thoughts on this. I know we're all, AI is going to be a requirement in essence for the next generation, really for this generation. But as we evolve, what are your thoughts on the need of having someone that's focused, a position that's focused on insights to be able to vet them, mine them, really own, or as far as an ownership standpoint, do you think that is worth the investment based on your experience?
That's a good question. I've been an inside lead for two different therapeutic areas in my time. I've also worked on on the clinical science side as well as on the commercial side on rotations. I think it's being able to mine for insights. It's an enterprise level investment, and it requires a human in the loop.
So, yeah. So do you think so based off this, do you feel like it's something that if done really well, requires a focused role specific to insights.
I was going to ask the same thing. Instead of having a person be the lead on their team, just have one person. That's all they do.
I believe so. I think the other thing also is that for a larger company or a company that has multiple different portfolio molecules, is what you're picking up as a signal only specific to that therapeutic area, or is it more of an institutional level?
Yep.
I think that's another part that maybe we don't talk about. We don't talk about it because we don't get to share the signals between different teams, right? So I think enterprise-wide, I think these roles will be important.
Yeah. I think even as you're thinking about organizations, I think this is important for small organizations, quite honestly. Even maybe it's a director of medical strategy, and that's part of their role is the insight components. But yes, especially in those lean organizations too, you need to make sure that you're spending the money, your business is spending it where it needs to be to be able to get something to market, maybe, for example, as well too. I'm in a complete agreement with you. I definitely think companies don't need to just rely on every one of their employees being able to utilize AI, but someone that's being able to hold them accountable for it, and then help train and teach them. So this has been a great discussion. Just a couple of questions and we'll wrap things up. Can you tell us about, when you think about leaders measuring the value and impact of insights, can you talk about what that might look like as far as an insight showing value? You've made a few references about it in concept, but can you summarize the different ways that you've seen insights be impactful for an organization?
I think the impact is not just about the volume of insights that are coming in, but documenting how those insights have led to decisions made.
Yeah.
Either changing decisions or staying the course.
Is there ever an experience? So this is where I want to take insights, Mitch. What would it look like to use those in the field? Right. So let's take the key insight questions. If we're asking those, what if you utilize those with providers, whether it's to confirm what they're thinking? They want to know what their colleagues are saying, how they're acting, what they're doing. That was evident in COVID. How are people treating people? How are they doing, utilizing things from instead of face-to-face? Now they're doing it from telemedicine. How are they implementing this type of survey? Any of those types of questions, thoughts on that being a possibility to either confirm or have someone be able to rethink their current approach or philosophy?
I'm not sure, Chad. I think it would be kind of measuring. It would be kind of like something that's over a time scale that you can show that there's been changes that have been happening, either building on a conviction or kind of conviction over a clinical conviction over time.
Yeah, Mitch, this is always these conversations with you are always so enlightening. So thanks for taking time again. I think that there's still questions that we could certainly ask you, and maybe we have you back for part 3 here sometime soon. This is good. This is all it is, right? It's casual conversation. Any closing thoughts from your end, Mitch?
No, thank you for the opportunity. Happy to share this platform with you. And then also thank you for responding back to my LinkedIn posts and, adding more value to it as well. So I always like these discussions that allow me to kind of change my mindset as well.
Mitch, that's how we leaders don't learn in isolation. That's one of the things we realize, right? So being able to continue to grow together, and it sparks new ideas. So always enjoy. Thanks for making that post. Thanks for making time to chat with us today. Could talk for hours, but no, we need to wrap things up. So look forward to our next conversation. Thanks, listeners, so much for joining us for another casual conversation. MSLead Chronicles, where leaders learn from leaders. We look forward to our next conversation. Until then, lead well.